A study of patients who'd had heart attacks showed that staying at home may be safer than going into hospital. The patients in the trial were allocated at random either to a hospital bed or to staying at home. The authors of the paper reported that the mortality rates for the two groups were similar. Whatever advantage patients might have had through going into hospital and being surrounded by machines, doctors and nurses was matched by the hazards of going into hospital. Before the industrial age, hospitals were built like cathedrals in order to lift the soul and ease the mind. Hospitals were decorated with carvings, works of art, flowers and perfumes. Modern hospitals are built with no regard for the spirit, eye or soul. They're bare, more like prisons than temples, designed to concentrate the mind on pain, fear and death. In the United Kingdom, the number of senior managers in hospital has risen every year for decades. At the same time, the number of nurses and auxiliaries and cleaners keeps falling. There are more administrators in hospitals now than there are beds, nurses or cleaners. It's not surprising that staff spend much of their time filling in forms to satisfy the bureaucrats, while the number of patients contracting serious deadly infections continues to soar. In many countries, doctors, both in general practice and in hospital, are now working strictly limited hours. As a result, it's rare to see a doctor in a hospital at weekends. Patients are left lying in bed all weekend. No one, it seems, has heard of deep vein thromboses or pressure sores. You're between 8% and 26% more likely to die if you're admitted to hospital at the weekend than you are if you're admitted to hospital during the week. Another problem is that you're more likely to catch a serious life-threatening infection in hospital than anywhere else. The great danger, of course, is that you may catch an antibiotic-resistant infection. Surgical deaths number tens of thousands a year in the UK alone. But 9 out of 10 operations are done to improve life rather than save life. This means that many of the patients who die as a result of surgery didn't need their operation. Another unrecognised danger of going into hospital is that you may starve to death. Patients in hospital need a relative or friend to feed them if they can't feed themselves. The bottom line is that Coleman's 6th law of medicine is that too often, I'm afraid, hospitals are not suitable places for sick people. If you need to go into one, you should try to get out as quickly as you can.